Something as small as bacteria in your pet's teeth can steal precious years from their life. And that same bacteria can travel through the bloodstream and attack vital organs like the heart, liver, and kidneys. If you think bad breath in pets is normal, prepare to discover a truth that can completely change how you care for your companion. Today, we're going to explore a subject that most pet owners completely underestimate. We're going to tell how your animal's oral health can be the difference between a long and healthy life or years of silent pain and serious diseases. By the end of this video, you'll know exactly how to identify warning signs, what the biggest myths about dental care in pets are, and most importantly, how to protect your best friend in a simple and effective way. Before we begin, please leave in the comments your name and the city where you're watching our content from. Let's start with a statistic that will surprise you. More than 80% of dogs and 70% of cats develop some form of dental disease by 3 years of age. This means that the overwhelming majority of pets are already suffering from oral problems before even reaching adulthood. And here's the scariest part of all: most owners don't even notice. Periodontal disease is considered the most common condition in dogs and cats, and it doesn't stop at the mouth. When bacteria from the oral cavity enter the bloodstream, they can cause significant changes in the heart, liver, and kidneys. Recent studies show that pets with advanced periodontal disease are 2 times more likely to develop chronic kidney disease and 6 times more likely to develop endocarditis, a serious infection of the heart valves. But how does this happen? Let's explain in simple terms. It all starts with bacterial plaque, an invisible and sticky film that constantly forms on your pet's teeth. This plaque is composed of thousands of bacteria that organize themselves into a kind of biofilm. When plaque isn't removed regularly, it mineralizes and transforms into tartar, that yellowish or brownish crust you can see on your animal's teeth. The tartar above the gum line is just the tip of the iceberg. The real problem is below the gum line, where you can't see. That's where bacteria cause the most damage, destroying the tissues that support the teeth and creating pockets of infection. These bacteria can then enter the bloodstream and travel to distant organs, causing inflammation and systemic damage. Gingivitis is the first stage of periodontal disease and is the only one that's truly reversible. In this phase, the gums become red and inflamed, but there hasn't been irreversible tissue loss yet. If untreated, gingivitis evolves into periodontitis, a much more serious condition where there's progressive destruction of the bone and tissues that support the teeth. In advanced stages, pets can develop painful abscesses, pathological jaw fractures, and even oronasal fistulas, holes that connect the mouth to the nose. But remember, long before reaching this extreme point, bacteria are already circulating through your pet's body, causing silent damage to vital organs. Now that you understand the severity of the problem, let's talk about the signs your pet might be sending that you might be ignoring. The problem is that pets are masters at hiding pain. They have a strong survival instinct that makes them continue eating and acting normally, even when they're suffering intensely. The first and most obvious sign is persistent bad breath. Forget that idea that dog breath is normal. Healthy pets don't have bad breath. If you can't stay near your animal without feeling an unpleasant odor, that's a clear sign of dental disease. Bad breath is caused by decomposing bacteria in your pet's mouth. Also observe if your animal is eating differently. Pets with dental pain may chew only on one side of the mouth, drop food while eating, or avoid harder foods. Some may even stop playing with chew toys they used to love. Other signs include excessive salivation, especially if you notice blood in the saliva, swelling in the face or around the eyes, and behavior of scratching or pawing at the mouth and face repeatedly. In cats, an additional sign is neglecting personal hygiene. Cats with dental pain often stop cleaning themselves adequately because the movement causes discomfort. Behavioral changes are also important. Some pets become more irritable when they have dental problems. If your normally sociable animal is avoiding contact or reacting badly to touch in the head region, this may indicate oral pain. Unexplained weight loss can also be a sign, especially if the pet is interested in food but eats less than normal. Let's explore some of the most dangerous myths about dental health in pets. Myths that may be putting your animal's life at risk at this very moment. The first myth is that dry food automatically cleans teeth. This belief is completely false and can even be harmful. The idea that kibble has a brushing effect is clever marketing, but has no solid scientific basis. Most dry foods, especially for cats and small dogs, come in small pieces that are often swallowed whole or break immediately upon contact with teeth, losing any abrasive effect. Scientific studies show contradictory results about the benefits of dry food. A large 1996 study that analyzed 1,350 dogs in North America found no significant differences in dental health between dogs fed only dry food versus other types of feeding. In fact, some research suggests that the high processing and carbohydrates present in dry food may even contribute to plaque accumulation. The second dangerous myth is that small pets don't need dental care or need less care. The reality is exactly the opposite. Small dogs and flat-faced breeds are more prone to periodontal disease due to reduced jaw size and tooth crowding. Studies show that small breeds can have up to 5 times more chances of developing periodontal disease compared to giant breeds. The third myth is that only elderly pets need oral care. As we saw earlier, more than 80% of dogs already show signs of dental disease at 3 years of age. Starting dental care early isn't just recommended, it's essential to prevent future problems. There's also the myth that if the pet is eating normally, their teeth are fine. Pets can continue eating even with severe dental pain due to survival instinct. Cases have been documented of dogs eating normally, even with jaw fractures, caused by untreated dental abscesses. Now, let's talk about what you can do at home to protect your pet. Daily brushing is, without doubt, the gold standard for oral health maintenance. Just as we brush our teeth twice a day, your pet benefits enormously from regular brushing. To start brushing, choose a time when your pet is calm and relaxed. Always use toothpaste specific for pets, never human toothpaste, which contains fluoride and xylitol, substances toxic to dogs and cats. Pet toothpastes come in attractive flavors like chicken, beef, or peanut butter. Start gradually, letting your pet smell and lick the paste to get used to it. In the first days, just touch the mouth and teeth with your finger. Then introduce a soft toothbrush or finger brush. Ideally brush daily, but even 3 times a week can make a significant difference. During brushing, focus on the external surfaces of the teeth, especially at the gum line where plaque accumulates most. Use gentle circular movements and be patient. If your pet resists too much, stop and try again later. Forcing the process can create negative associations. Besides brushing, there are other useful tools. Specific dental toys can help remove plaque through the mechanical action of chewing. Look for products approved by the Veterinary Oral Health Council, which scientifically tests the effectiveness of dental products. Raw meaty bones can help, but should be used with caution. Raw poultry bones are generally safe, but cooked bones should never be offered as they can fragment and cause internal damage. Very hard bones can also fracture teeth, so always supervise your pet. Water additives, dental gels, and dental wipes are options for pets that don't tolerate brushing. Although not as effective as brushing, they can be useful as part of an oral care routine. No matter how diligent you are with home care, your pet still needs regular professional cleanings performed by a veterinarian. These cleanings are performed under anesthesia and allow complete evaluation of the oral cavity, including areas below the gum line that are impossible to clean adequately at home. During a professional cleaning, the veterinarian removes plaque and tartar through ultrasound and special manual instruments, both above and below the gum line. Dental x-rays may be necessary to evaluate the health of tooth roots and jawbone. After cleaning, teeth are polished to create a smooth surface that makes future plaque adhesion difficult. The frequency of professional cleanings varies according to the pet's age, breed, and dental condition. Young and healthy pets may need annual cleaning, while animals with a history of dental problems may need cleanings every 6 months. Many owners are afraid of anesthesia, but it's important to understand that modern veterinary anesthesia is very safe when performed with adequate pre-anesthetic evaluation. The risks of anesthesia are minimal compared to the risks of leaving dental diseases untreated. Anesthesia-free cleanings offered by some non-veterinary professionals are dangerous and ineffective. They remove only visible tartar above the gum, leaving problematic areas below the gum line untouched. Additionally, the stress and forced restraint can be traumatic for the animal. The investment in dental health can literally add years to your pet's life. Pets with healthy teeth not only live longer, but have better quality of life. They eat better, play more, and don't suffer from chronic pain that often goes unnoticed. Studies show that pets receiving regular dental care have lower incidence of heart, kidney, and liver diseases. Preventing periodontal disease reduces bacterial load in the organism, allowing the immune system to function more efficiently to fight other health threats. The cost of prevention is always much lower than the cost of treatment. A preventive cleaning can cost between $50 to $300, depending on location and pet size. Treatment of advanced periodontal disease can cost between $500 to $800 or more, not counting the costs of treating systemic complications. Pets that maintain good oral health are also more sociable and happy. Chronic dental pain can cause irritability, depression, and abnormal behaviors. When this pain is eliminated, many owners report that their pets went back to being like before, more playful and affectionate. Your pet's dental health isn't a luxury, it's a basic necessity that directly impacts their quality of life and lifespan. Remember that your pet depends completely on you for all aspects of their health and well-being. Start a dental care routine today. If your pet has never had their teeth brushed, introduce the process gradually. If it's been a while since they had a dental evaluation, schedule an appointment with your veterinarian. And if you notice any of the signs we discussed today, don't wait. Seek professional help immediately. Your pet deserves to live without pain and in full health. Dental care is one of the most effective ways to ensure this. Don't let something as simple as bacteria in teeth steal precious years from your best friend's life. If this video was useful to you, leave your like and subscribe to the channel for more content about pet health. Share this knowledge with other pet owners because together we can ensure our companions have longer, healthier, and happier lives. Until next time.